social anxiety disorder, as according to the Diagnostic and Statistical Manual TR5. The diagnostic criteria includes A. Increased fear or anxiety in one or more social situations, such as, for example, performing in front of others, being observed, and being in social interactions. B. Fearing that the individual acts in a certain way or being seen as showing anxious symptoms that leads to being negatively evaluated. C. Social situations that provoke fear. In children, this fear could manifest as tantrums, crying, shrieking, clinging, or failing to speak. D. Social situations are avoided or endured with intense fear or anxiety. E. Fear or anxiety is out of proportion compared to the actual social situation or context. F. Fear, anxiety, or avoidance is persistent for 6 months or more. G. It causes clinically significant distress. H. It is not due to any substance usage. I. It is not better explained by symptoms of another mental disorder like panic disorder, body dysmorphia, or autism. J. It is not better explained by other medical conditions like disfigurement from burns, obesity, or Parkinson's disease as examples. We also have to specify if it is performance only, where fear is restricted only to speaking or performing in public. This specification helps to identify when it is the most impairing in one's professional, such as there could be a musician, athlete, dancer, etc., or academic setting. They typically do not avoid nor fear non-performance social situations, but only fear when performance is required, when performing or acting or singing or dancing is required. So to explain more about the diagnostic features, I'll go into detail. One such diagnostic feature is that social anxiety disorder includes intense marked fear or anxiety in social situations where individuals have the possibility of being judged and scrutinized by others. That's criterion A. Children manifest fear or anxiousness in interactions with adults and in peer settings. Individuals fear that they would be considered intimidating, stupid, boring, crazy, weak, and unlikable. That's according to criterion B. Anxiety symptoms manifest as trembling, sweating, staring, stumbling over words, blushing, fear of negative evaluation by others, or fear of offending others. These symptoms may cause individuals to avoid eating, drinking, riding, pointing in public, or urinating in public restrooms, also known as paruresis. Sweatiness may cause individuals to avoid shaking hands, eating spicy food, etc. Individuals fearing blushing may avoid bright lights, public performance, or discussing intimate topics. The social situations almost always provoke fear and anxiety according to criteria C. Typology and degree, however, vary. For example, it could manifest as anticipatory anxiety, where individuals worry weeks before social events or repeat speeches for days and days on end, or it could manifest as panic attacks. As a result, these situations are often avoided, which is criterion D. Examples can be that the avoidance is extensive in that individuals stop going to schools and avoid parties, or it could be subtle like diverting one's attention or limiting eye contact, etc. The anxiety or fear is judged to be out of proportion to actual risk or negative evaluation, or the consequences of negative evaluation, as according to criterion E. The disturbance duration should be occurring at least 6 months according to criterion F. The individual needs to be clinically impaired or significantly distressed, as according to criterion G.